A growing number of Americans are once again traveling internationally to seek medical care.
It's called medical tourism, and according to international consulting firm Patients Beyond Borders, it's popular for people seeking more affordable care and those looking to bypass long waits for treatment. The group estimates that in 2020, between 1.4 million and 3 million people went to Mexico to take advantage of inexpensive treatments.
That's promising news for the business, but experts warn there are risks. Raul and Lori Valenzuela say they tried everything to lose weight, but when nothing seemed to work, they turned to bariatric sleeve surgery in September of 2018 to try to get their lives back on track.
My wife wanted to do it, and I was still reluctant because it is Mexico.
The couple from Olive Branch, Mississippi, say they couldn't afford the procedure in the United States. According to research in the National Library of Medicine, it can cost up to $25,000 per patient. So taking the advice of friends, the Valenzuelas went across the border into Tijuana, where they say they were able to get both surgeries for around $7,000.
Me being as overweight as I was at 278 pounds, is something that, I especially needed to do.
Lori's procedure was a success.
Perfect. Not a hitch. Nothing wrong with her. Nothing.
But for Raul,
mine was the worst case scenario.
The surgery nearly killed him. Less than a week after returning home, his stomach ruptured and he became septic. He also contracted a drug-resistant superbug called Pseudomonas.
I'm not supposed to be here.
It's a risk more and more Americans are taking.
These high costs of care and our broken healthcare system are forcing millions and millions of patients to make decisions that they otherwise would not have made.
According to Patients Beyond Borders CEO Joseph Woodman, about 2 million Americans travel internationally for care each year to destinations including Mexico, Brazil, Costa Rica, and India, and that number is growing. Patients Beyond Borders says those patients can save between 20 to 90% on medical bills, depending on the procedure and the country. The Journal of the American Pharmacist Association surveyed more than 400 medical tourists in 2020 and found that most, 92%, were motivated by money.
In the United States, it's all about cost.
According to the CDC, the most common procedures include dental care, cosmetic surgery, fertility treatments, organ and tissue transplants, and cancer treatment.
I haven't been to a U.S. dentist in 14 years. I've had implants, I've had crowns. It's all very efficient. You got to go to the right clinics, though.
Woodman supports medical tourism and says it can be safe, but patients need to do their homework. He cautions that quality and safety criteria for providers, facilities, drugs, and medical devices are not always consistent across countries and hospitals.
It's absolutely imperative, job number one, for patients to do their research and not rely simply on references from friends.
You don't want to price shop, for example. You don't want to go to the very least expensive clinic that's offering the least expensive surgeries. There can be a lot of trouble around that as well.
The CDC says the most common complications are infection-related. They advise not delaying follow-up care if necessary, as early diagnosis and treatment can lead to better outcomes.
Obviously, the complication that is most dreaded is just death, not surviving the incidents. And there have been examples of people who are not board certified doing liposuction and cause life-threatening injuries, right? So there are significant risks.
Patients Beyond Borders says global accreditation organizations like the Joint Commission International can help Americans find more reliable care overseas. International hospitals accredited by the JCI are held to the same standards as those accredited in the United States. More than 950 hospitals and clinical departments worldwide have earned this recognition, though the CDC cautions that accreditation does not guarantee a positive outcome. For Raul Valenzuela, weight loss surgery was life-changing, but for all the wrong reasons. He spent weeks in a U.S. hospital receiving corrective care and ultimately had to have his stomach removed. To this day, he says staying nourished can be a challenge, and painful constant reminders of his near-death experience.
If I would have known then what I know now, I would have stayed fat.
In June 2023, the CDC issued a travel warning over medical tourism after 3 people died of a fungal infection linked to cosmetic procedures done in Matamoros, Mexico.
Since January of 2023, the CDC has identified 14 suspected, 11 probable, and 2 confirmed U.S. cases. They also say more than 200 U.S. residents in 25 states could be at risk for the infection, which can appear weeks after the procedure.
For those considering medical tourism, the CDC recommends you purchase travel health insurance, get a pre-travel consultation, bring medical records to the treating facility, take updated records home following surgery, and arrange necessary follow-up care prior to the procedure. For more information on JCI-accredited hospitals, you can visit www.jointcommissioninternational.org.